We're trying to do here something that is new and unique. In a country with so many competing priorities, somebody has got to make the decision that this is a priority among priorities. And that this has been done is because of leadership. We thought that malaria was here to stay. When you look at the statistics and we say we've seen a 60% drop in malaria mortality and morbidity, you can see it on the ground, the empty beds, the pediatric wards and elsewhere. So there's been very real success. Simple things that work, long-lasting insecticide-treated nets, residual indoor spraying, simple and effective drug, ACT, a community health worker system, enabling people to have health insurance.
In 2006 September, it was our first big campaign. So we distributed more than 1.5 million nets to under 5 kids, and starting this new treatment with ACT. It have been only waiting this combination of a strong program of prevention and the strong drugs, and then it was like things started to change.
Malaria muri ibi bihe iragenda igabanuka, mbere niho yari nyinshi ariko kuva
Malaria is reducing compared to the last years because of the program they started distributing mosquito nets and killing mosquitoes in the houses. She has 9 children, and before the use of supernet, they used to get really sick, but now as they got educated about supernet, they no longer get sick.
Trust IRS as the solution to malaria. They are comfortable with it. They're not worried about malaria because they have this IRS.
Nyuma haje ko Arteme nayo tuyikoresha mu kuvura malaria. Ariko ikigaragara nuko aho Primo igereye ku isoko.
When Primo came, malaria reduced at a very good pace. Yes, the parents come to buy for the little children.
We want to make sure that we are treating really malaria. So this rapid diagnostic test will avoid resistance for drugs if you use it properly. The perspective is to have this test available at the community level, making sure that our community health workers are now treating malaria, not fever for flu or fever for any other disease. I think we have to be very careful to keep the good result that we have now, keep all of this strong method of prevention. The success are there. Imagine we go for strong prevention campaign with distribution of nets, new drugs. Just 2 years after, you have results. If you compare to what you have been saying, the difference is there. You feel the impact of what you are doing here.
We cannot eliminate malaria alone. We are a landlocked country, so we need also to have the same resources for all the neighboring countries.
The malaria cases, there are still many. At a certain point in 2007, it decreased, but it started to come up again. Even we have sometimes forced to add more beds because the space is not enough.
This year we are going to buy 4 million of long-lasting nets. This is with the Global Fund around 8. So we are going to do a integrated measures campaign and to distribute house-to-house long-lasting nets using community health workers. So we have at least 30,000 community health focus in charge of case management in all villages.
They educate people, telling them whenever you get malaria, please immediately go to the hospital. Every person who comes to the hospital and get the medication gets better. So they just tell people malaria can be healed.
Financing cannot decline at the rate that the malaria declines. Because we have succeeded so well, our people are demanding that we not only stop malaria but eradicate it, so they won't accept anything less. It gives hope to our neighbors that it can be done. Those are things which, with the availability of funds at a global level, we've been able to do on a scale we hadn't been able to do before.